If your ears started ringing after a COVID infection or simply being exposed to COVID and your doctor has no answers, you are not imagining things and you are far from alone. COVID tinnitus is now documented in peer reviewed research from multiple institutions, and the numbers are striking. Today, we are going to walk through what is actually happening in the body and what you can do about it naturally. A cross sectional survey of 1,331 former COVID 19 patients found that 27.9% reported tinnitus following infection. A separate study found that 22.6% of COVID patients experienced tinnitus, with women more prone than men. And tinnitus severity scores measured on validated clinical scales increased significantly from before the pandemic to during it and remained elevated afterward. This is not a coincidence. COVID does something specific to the auditory system. The inner ear is highly dependent on microvascular perfusion. The cochlea and auditory nerve require consistent, clean blood flow and an inflammation free environment to function properly. COVID disrupts both. Research documents that the virus triggers widespread neuroinflammation through microglial activation and a systemic cytokine storm. And this same inflammatory cascade reaches the auditory brainstem pathways and cochlear nerve. When these pathways become inflamed, they generate phantom sound signals. On top of that, COVID affects endothelial tissue throughout the body, and the cochlear microvasculature is extremely fine and particularly vulnerable to that disruption. One of the most important pieces of this picture is what COVID does to viruses already living quietly in the body. The herpes virus family, including Epstein-Barr virus, HHV-6, and HSV, is carried by the majority of adults in a latent, suppressed state. COVID, however, disrupts that balance by depleting the body's methylation capacity, the biochemical process used to silence latent viral DNA. When methylation breaks down, these dormant viruses reactivate. EBV and HHV-6 in particular have an affinity for neural tissue, including the auditory nerve. Bartonella is worth mentioning here too, since there has been a significant uptick in Bartonella post-COVID, and it has a particular affinity for the microvasculature of the inner ear. We've seen an uptick recently in tick-borne illnesses here in the United States, and Bartonella is a co-infection of Lyme. My foundation has always been whole food nutrition, real food, ancestral eating, nutrient-dense living, but the sheer volume of synthetic compounds in our modern environment, combined with viral insults like SARS-CoV-2, has created situations that sometimes require tools outside of whole food formats. And this is where the methylated B vitamins are one of those tools. Not because food-based B vitamins are not wonderful in a pristine world, but because we do not live in a pristine world, supporting this pathway with methyl B vitamins, TMG and DMG is foundational in addressing COVID tinnitus from the root. This is not a treatment for COVID tinnitus, it's a framework for supporting the body's terrain. Start with methylation, the foundation. Then support the auditory nerve directly with things like magnesium L-threonate, which does cross the BBB or the blood-brain barrier and can then reach the neural tissues. And then address latent viral reactivation with things like lauricidin, which disrupts the lipid envelope of enveloped viruses, paired with things like lysine. Support cochlear circulation through hydration and lymphatic movement. I have articles on my website about the drainage of the neck and how this part of the body is so important to use lymph creams or lotions and massage the neck to be able to detox this area. And finally, a topical approach using some DMSO applied behind the ear. This roll-on that I have a recipe for on my website delivers antiviral and anti-inflammatory compounds directly to the tissue surrounding the auditory nerve. DMSO acts as the penetrating carrier, crossing skin and reaching nerve and vascular tissue directly. Castor oil is the secondary carrier and is anti-inflammatory. And then I add lemon balm essential oil, which is documented as an antiviral against the herpes family, and it reduces plaque formation by about 99% for HSV1 in published research. Then I add in some fluoride-free green tea extract, which provides antioxidant support to the cochlear vascular tissue. And then you can apply it behind the ear, along the mastoid bone, and down the neck, along the cervical lymph nodes, once or twice a day. Red light therapy is worth considering as a complementary approach, working through two distinct routes. Nasal delivery brings red and near infrared light into the highly vascularized nasal cavity, supporting nitric oxide production and improving microvascular circulation to the cochlea. Ear canal delivery targets the cochlea and auditory nerves directly, supporting mitochondrial function in cochlear hair cells. Using both together addresses the systemic vascular piece and the local tissue repair piece simultaneously. This is one of the most common questions people ask, and the research gives a sobering answer. How long does COVID tinnitus last? A cross-sectional survey found that as COVID tinnitus severity increases, the chances of natural recovery without intervention decrease. Grade 4 severe tinnitus was the most common presentation, affecting 33.2% of post-COVID tinnitus cases, and was strongly associated with the risk of developing long-term hearing loss, anxiety, and emotional disorders. This means addressing it sooner and more completely gives the best outcome. Tinnitus after COVID that is rooted in viral reactivation and neuroinflammation does not resolve overnight, unfortunately, and the sequencing matters as much as the protocol itself. Support drainage first so the body has an exit route. Restore methylation so the silencing mechanism can come back online. Then address the viral terrain and nerve tissue support together. If COVID tinnitus started after your infection and has persisted, this is your body signaling that something systemic needs attention. The ringing is not the problem. The ringing is simply the message or the messenger. And you can find the full article, the complete protocol, and the DMSO roll-on recipe at dodisafa.com/COVID tinnitus. Thanks so much for being here, and I look forward to seeing you in the next presentation.